Washington Journal continues.
Our first guest of the morning, Dan Adcock of National Committee to Preserve Social Security and Medicare. He serves as their Government Relations and Policy Director. Good morning to you.
Good morning, Pedro. Thanks for having me on.
The name of the organization is obvious, but tell us about it and what's your mission?
Well, our mission is to focus like a laser beam on the advocacy for beneficiaries who are in Medicare and Social Security and will be in Medicare and Social Security to ensure not only are these programs strong and good for the people to provide them economic and health security today, but also for their kids and grandchildren. We were started by Jimmy Roosevelt, who is a member of Congress from California, who just happened to be the eldest son of Franklin Delano Roosevelt. So you might say that the Roosevelts are in our DNA. In fact, James Roosevelt is on our board of directors, and we're happy to have him. But also we're equally devoted to Lyndon Johnson's legacy of Medicare and Medicaid on the Older Americans Act as well. But
how is the organization funded?
The organization is exclusively funded from membership dues. We only charge $12 a year, so it's actually a pretty good deal. But we don't take any money from any outside groups, don't take any money from pharmaceutical companies or insurance companies or Wall Street. So it allows us to be pure in terms of our advocacy on behalf of our beneficiaries.
We'll talk about the politics of it in a moment,
sure.
But if you can give your own assessment of where Social Security and Medicare are fiscally as of today.
Sure. Well, according to the most recent trustees reports for both Medicare and Social Security trustees on Social Security, the Social Security Trust Fund currently has $2.8 trillion of it and will continue to have reserves until 2034. And then those reserves will be depleted. But it never becomes bankrupt because the payroll taxes continue to flow in the program, which means that even though the trust fund will become depleted, as projections are until 2034, there'll still be money coming in. But that means that if Congress fails to act between now and then, there would be a 20% cut. We don't want that to happen. We'll work very hard to make sure that there's sufficient revenue coming into the program to ensure that it's there. For Medicare, it's a different story. Until 2031, the Part A trust fund, that's part of Medicare, that's responsible for paying for in-hospitalization, is there. We think there's proposals in the president's budget that will extend the life of that trust fund for a long time to come. It's a little more complicated because healthcare is complicated, but we can get more into that.
We can also talk about the politics of it as well. It became a political issue this week from statements earlier on from the former president. I want to play a little bit of what he had to say a couple of days ago and then get your comments on that.
One thing that I think that at least the perception is that there's not a whole lot of difference between what you think we should do with entitlements or non-discretionary spending and what President Biden is proposing. It's almost the third rail of politics. And we've got a $34 trillion total debt built up, and very little we can do in terms of cutting spending. Discretionary is not going to help. Have you changed your outlook on how to handle entitlements, Social Security, Medicare, Medicaid, Mr. President? It seems like something has to be done, or else we're going to be stuck at 120% of debt to GDP forever.
So first of all, there is a lot you can do in terms of entitlements, in terms of cutting, and in terms of also the theft and the bad management of entitlements, tremendous bad management of entitlements. There's tremendous amounts of things, numbers of things you can do. So I don't, necessarily agree with the statement.
That was a couple of days ago. It was followed up, Mr. Adcock, by an interview with the former president on Breitbart saying, and I'll just pull you the quote, saying, "I will never do anything that will jeopardize or hurt Social Security or Medicare." Those are the statements as they stand. What's your response to it?
Well, actions speak louder than words. We know that when the former president issued his budgets, he recommended that Social Security be cut by $64 billion every year that he was president. So we know that on one hand that he is unlike many Republicans in breaking the Republican orthodoxy of being supportive of doing things like cutting the cost of living adjustment or raising the retirement age. But in reality, as president, he suggested cuts to the Social Security program. So I would, words again don't necessarily mean anything, but what you do does. But we know from past actions that he has been willing and has listened to people who support cutting Social Security.
Do you think that there's a general appetite to make those kind of changes that you're concerned about?
I think there is for those who support it, but they know that it is very unpopular to do that. Whenever my organization, the National Committee to Preserve Social Security or Medicare, or any news organizations has done any polling to suggest that the program should be cut, it's very unpopular, and it doesn't matter whether you're a Republican, Independent, or Democrat. Very unpopular, and so that's why they have been reluctant to do that, and they would like to bring in. That's why they have suggested things like a fiscal commission, for instance, where they could make it more bipartisan, so they could do what is called everybody jumping off the cliff together to come to a solution to make those cuts, because that's the only way they know politically they can get away with making cuts to programs where people consider their benefits earned. They consider their benefits their money.
The former president's response team had put out after that initial interview saying that the focus was more on waste and reducing that kind of waste in the programs. Is there something there, though, as far as waste and fraud within the programs that both Social Security and Medicare?
Not to the extent that the president suggested. If you talk about any program, whether it's public or private, there certainly is always going to be waste, and there's always going to be ways to try to reduce that waste. But when you look at the overhead of the Social Security program, just on the Social Security program alone, it's only about 0.5% of the actual money that's paid out in benefits. That's 1.6 trillion every year that's paid out in benefits. And so it's already pretty low. That doesn't mean it can't be lower. And I think that we're going to get to that point, especially with the new commissioner at Social Security, Martin O'Malley, who is the former governor of Maryland. He's got a lot of great administrative experience. We've already talked to him. We think he's has the potential to do a great job, and we think that he will do a lot with what he has, which unfortunately has been a very underfunded budget for the administration of the agency. Our
guest is with us until 8:45, and if you want to ask him questions about the politics behind Social Security and Medicare, the actual status of the programs themselves, 202-748-8000 for Democrats, Republicans 202-748-8001, Independents 202-748-8002. For those who receive either Social Security or Medicare and you're a recipient of those programs and you want to give your thoughts too, you can call us at 202-748-8003 and use that same number if you want to text us too. Before we go to the calls, since the president and the former president introduced it and President Biden responded to it, do you think this becomes an issue going forward in campaign 2024, and to what extent?
Well, I sure hope so. And the reason why I hope so is I think that when people go into the voting booth, they really need to think about this issue. Very important. If you're in your 30s and 40s, you may not even be thinking about Social Security. But if this program is cut, if Social Security is cut, or Medicare is cut, and older people has less economic and health security, it means grandma is going to be living with you. And so even though you don't think you would be immediately affected, you might be, because it's going to force your elderly relatives to make decisions like that. So that's why it's so important for people to think about in this election, not only for current retirees, but for their own future and their immediate future.
Let's take some calls.
Sure.
This is from Robin. Robin in Alabama, Independent Line. You're on with Dan Adcock. Good morning. Go ahead.
Thank you, C-SPAN. My question is, would mass immigration help Social Security, save Social Security? And if so, how? And if not, why? And Pedro, you guys ought to have a topic. If so, then the topic should be, would America accept mass immigration to save Social Security? Thank you. I'll take my call offline. Thanks
for the suggestion, Mr.
Robin, that's a great question. I guess I can answer it two ways. If people are entering the country as undocumented workers, frequently they're getting Social Security numbers and they're actually paying Social Security payroll taxes. But unless they get a green card or become a citizen, they're never going to see a dime of the money that they're contributing to the system. So that actually helps the system. But it's interesting. The Congressional Budget Office a number of years ago, about 10 years ago, when the Senate passed an immigration bill with a pathway towards at least a green card, if not citizenship, they found that if people became legal citizens or got green cards, they got out of the shadows. They worked in jobs that paid more, and they were paying Social Security payroll taxes. And so they found, that the Congressional Budget Office found, that the solvency of the trust fund, of the Social Security Trust Fund, would be extended by year if you were to enact a pathway towards a green card or citizenship.
From Margie. Margie, Republican line, Pennsylvania. Go ahead.
Good morning. I just want to say that 70 years ago, I'm now 86. 70 years ago, I won a local contest. We were writing for the VA or something about why Social Security was such a bad idea. And now that I'm living on it completely now, but I still think it's a bad idea. And it was a terrible idea to begin with when it was just a minor thing. And now the monolith that it's become is I have no idea how you could fix it. But please show the pie chart so that people can see how much of the budget is consumed with Social Security. And also, please explain to people when they get all up in arms and say, that's my money. Well, I've been both management and labor. Half of that is your money. Your employer contributed half.
Margie, if I may ask, you said you were on Social Security. Is that your sole source of income, if I may ask?
That is my full and only source of income. And I'm going back to why it was such a bad idea. The minute you plant in someone's mind that the government is going to take care of them, that affects their whole life. If people understood as they're growing up, as they're being educated, that they are responsible for themselves, then we wouldn't have this.
Margie, thank you very much for giving your input.
Well, in terms of the budget, what I would say is that, and Margie, thank you for your question. I think that it's important to realize that Social Security is financed through payroll taxes. It's a dedicated tax, which means that it doesn't add a penny to the deficit, to the debt, and it's a self-sustaining program. But in terms of the employer contribution to Social Security, that's part of your employer's compensation to you. In the same way, if you were lucky enough for your employer to provide separate retirement benefits, that's also compensation to you as well. So it's a great program. And Margie, you're not alone. There's 40% of Social Security beneficiaries depend on the program for 90% or more of their income from Social Security. So if you were to cut that program, just think how many people would be in fairly dire straits to the extent that a lot of them would shift into poverty. We're really lucky today that only 9% of seniors live in poverty, but if you were to cut Social Security benefits, that number would go up. And so that would be a tragedy.
In his 2025 budget, President Biden advocating a different taxation system towards wealthier Americans to pay for these programs that you advocate for. What do you think about that avenue for funding?
We think it's a great idea. We think it would be a mistake to cut benefits in order to extend the solvency of the program. We think that the better pathway is to make sure the wealthy pay their fair share. And it's really about time, because when you consider the last time that we made major changes to the Social Security program was 1983. And when we taxed payroll income, we were capturing 90% of income in this country. Well, today, because of income inequality and because there's a great difference between the haves and have-nots, that we're not capturing 90% anymore of that income. We're capturing 81.4% of that income. And so that's an argument why that should finally be increased. And by doing that, we don't have to cut benefits. We can extend the program for decades. And so that's really the answer, is to make the wealthy pay their fair share towards the program.
That's the desire of the administration, but how realistic do you think it is?
Well, if we had majorities in the House and the Senate that were supportive of that idea, it could happen tomorrow. Unfortunately, we don't right now. But we hope that in the coming election to elect people to the House and the Senate that feel that way, that we can get to that direction. And the sooner we do that, the better, because these proposals, like raising the payroll tax on income above $400,000, they have more bang to the buck if it's done now, as opposed to closer to the date of the projected insolvency in 2034.
From Bruce. Bruce joins us from Lexington, Kentucky, Independent Line.
A couple just quick questions, and appreciate you taking my call. who raided the Social Security Fund in the late 60s. We're spending $500 billion on immigrants. What do we need to shore up the Social Security and Medicare?
Okay.
Well, thanks for your question, Bruce. Well, like I said before, I think the answer to shore up the program is to bring more revenue to it. As we've been talking about, we would, for income above $400,000. Well, let me kind of back up and explain something. Right now, if your income is $168,600 a year, you're paying 6.2% of your income towards Social Security. But let's say your income is above that. Let's say you're a wealthy CEO. There's a pretty good chance that you're paying a very smaller percentage of your incomes towards retirement. In fact, you're probably stopping paying your payroll taxes in January, February because of that. So that's an important thing. But in terms of rating the program has never been rated. I think that kind of notion comes from the way it is financed. It's a pay-as-you-go system, the way it's financed. So today's workers are paying for today's retirees. And the way that is done is that when you make your contribution with your FICA taxes towards Social Security, that money immediately goes to the government. The government takes that money and buys a U.S. Treasury security that earns interest. And then when it's time to pay benefits, that Treasury security is redeemed for cash, and then it goes to pay benefits. But in that time, in that transaction in which the Treasury security, when they take your money and they use it to buy a Treasury security, that goes to every function that the government pays for. So it's paying for F-35 fighters, it's paying for submarines, it's paying for Meals on Wheels. But eventually that money comes back to the same people who put it in the terms of redeeming that security for a benefit.
There was a recent op-ed in the Wall Street Journal. It was by two men, Terrence Keeley and Andy Pudzer, who wrote about maybe an idea to change the way these funds are invested. And here's what they propose, saying the Social Security system's headed for insolvency largely because it's restricted itself to investing exclusively in unmarketable U.S. federal debt equivalents, because bonds return only half of what stocks return over any multi-decade time frame, about 5% a year versus 10%. Social Security expenses are now running well ahead of the receipts. They compare it to the Canadian pension plan superiority, which stems from asset allocation. The fund invests about 57% of its assets in equities, 12% in bonds, the rest divided among real estate, infrastructure, credit. And then they make the case that over the past 10 years, the Canada pension plan realized a almost 10% annualized net return. What do you think about that idea?
Well, I think you need, when you think about retirement, and any retirement expert will tell you this, is that your income needs to be diversified. And especially as you age, you need to make less risky investments. I think the problem with investing part of the Social Security trust fund in these kind of assets is that they are risk-based. And we don't have to worry about that if they're invested in Treasury securities, which are considered to be they're the most widely way that people invest. I mean, that's why China invests in the U.S. Treasury securities. And so we think that the current system of doing that is the best way to do that, to ensure that the program is there. I mean, I think there's enough people who remember the financial crisis of 2007, and because we've moved towards from pensions to 401ks, that they lost the money during that period of time. It caused people to delay their retirements. And so we just want to make sure that there's something that is rock solid, and that is Social Security that will be there for people, and want to keep it that way.
Our guest is with the National Committee to Preserve Social Security and Medicare, Dan Adcock. He serves as the Government Relations and Policy Director. Tim joins us next in New York State, Democrats line. Hello.
Hello. Good morning, gentlemen. Mr. Adcock, I've been hearing some rumblings that Medicare might be on the chopping block, and that Republicans would like to eradicate Medicare altogether and replace it with Medicare Advantage. Could you maybe give us some information about that? Thank you.
Sure, that's a great question, Tim. There's been a lot of interest over the years in terms of privatizing Medicare. The direct way has been, or the direct assault on Medicare to privatize it has been through this idea of creating vouchers where people would go out and they could either buy traditional Medicare or they could go out and buy a private plan. That was something that, for instance, Paul Ryan, congressman from Wisconsin, and used to be former Budget Committee and House Speaker, supported. And then also we have what's kind of more, less a direct response, but an equally growing problem is Medicare Advantage plans. These are private Medicare plans, and I know that there's a lot of people that like them, and they may very well be right for them, but they are marketed in a way that you hear a lot about the pros of these plans, that sometimes they have additional benefits that traditional Medicare has, but they don't have a lot of the cons that people don't understand. I think one of the biggest cons of Medicare Advantage plans is they have a limited provider network. So that means that if you get a dreaded disease and you need to go to the Mayo Clinic, you may not be able to because your Medicare Advantage plan won't. But if you're in traditional Medicare, it does. But the problem is that, let's say there's a lot of younger people who are persuaded to go into a Medicare Advantage plan, let's say when they're 60, when they first become eligible for the Medicare program, but when they hit 70 or 75, they do have some serious health problem, and they need to go to a provider, a hospital, or doctor that's a specialist in whatever their issue is. It's hard for them to go from Medicare Advantage back to traditional Medicare because it's hard for them to get a Medigap plan that wraps around traditional Medicare. And so it could be very difficult in those sort of situations. But that is something frequently they're not told when they're sold on Medicare Advantage plans.
How often do you hear from younger people that maybe they're not interested in either one of these programs, and why should it concern me? And how would you respond to them?
I think that we find that most people, from experience that I've learned, is that I run into a lot of people who feel that way. But I think that they appreciate the program once they get into it. That, in fact, a lot of people find, especially with the Medicare program, that it provides better coverage than they had when they had employer-sponsored health insurance.
From George joining us from Idaho, Independent Line. Go ahead.
Good morning. Yeah, I just got a couple of quick questions. So I'll take my answer off air. The first one is, why do we treat the elderly and keep them under the poverty rate that are on Social Security? And two, why isn't there like a means test for millionaire people who make $1 million a year? They obviously don't need Social Security or Medicare. And that's what I had the question for.
That's George in Idaho.
Okay.
Thanks.
So, George, good question, and let me answer your first questions. I think there's something called the special minimum benefit that hasn't been updated, that we think needs to be updated so that it captures more people to ensure that they live above the poverty level. And there's legislation out there that's been introduced by Congressman John Larson from Connecticut that would do exactly that. And so that's why we supported it. As far as means testing the program, we're concerned that if you were to do that, if you were to lower benefits based on people's income, that could turn it into a welfare program. And the very important thing to understand about means testing the program, in order to achieve the kind of cost savings you would need to extend the life of the program, the solvency of the Social Security Trust Fund, you wouldn't just be means testing millionaires. You'd have to means test people down to the income level of $40,000 a year in income in order to raise enough revenue to extend solvency. So that's why we're opposed to means testing.
What was this year's cost of living increase for Social Security recipients?
It's 3.2%, which brings up a very important issue, is that over the years, over basically about a 14-year period, excluding the 2 years we had very high inflation, the COLA has only been 1.4%. And in those years, 3 of those years, we had the zero COLA. Well, people who were in that situation, who had Social Security, thought they didn't have zero inflation. We need a more accurate measure of inflation that the Bureau of Labor Statistics put together. We need something called the Consumer Price Index for the elderly that does especially a better job of measuring healthcare costs, because they tend to rise at a pace faster than inflation.
Should that CPI be tied to whatever increases come in the future?
We think so, because it would be more accurate, it'd be fairer, and most years it would result in a higher cost of living adjustment for seniors.
3.2%, you said. What's the highest COLA increase in recent history?
I think it's upwards of, I can't remember, it was over 8%, and that was one of the years of, where we had very high inflation. But it's like, now it's down to 3.2%. So you can see how much lower the CPI has gone because inflation is down.
From Sharon. Sharon in Pennsylvania, Democrats line. You're on. Go ahead.
Yes, thank you. A previous caller was preaching self-responsibility and so forth financially. That's well and good. But during the Great Recession, as a result of these manipulators and so forth, I lost back-to-back full-time jobs with benefits and overtime, and I was doing fairly well. After that, at age 61, I put in 100 applications. Who would hire a 61-year-old woman in the Great Recession? So I subsisted on unemployment for a while, plus low-paying temp jobs and part-time jobs, and was never able to get back to the level I had had. So many of us work more than one job just to make ends meet, and even as seniors. So please don't preach at us. Thank you.
That's Sharon there in Pennsylvania.
Yeah, Sharon, I think that's a great point, and you're not alone in your situation. This is why the Social Security program and Medicare are so important, because you don't know what your life is going to bring you. And we also know historically during the last 30 years that middle-class wages have been pretty much stagnant. And so that means that there's a growing share of Americans that depend on Social Security for most or all of their income. And so that's why it's important for the program to be there, for the program to be strong, and also to improve benefits for individuals so that they can live a decent quality of life in their golden years.
There's a viewer from, this is Steve in Massachusetts. He sent a text this morning saying, could you discuss the possibility of raising the cap on money subject to Social Security taxes? And you may have to explain that a little bit, but go ahead.
Right. So and Stephen, that's a great question, and I think it's one we support. So right now, the Social Security Administration, when you're a worker, you're paying payroll taxes on your first $168,600. And so any money you earn above that, you're not paying Social Security payroll taxes. So again, the example of a professional basketball player, for instance, probably at 12 noon on January 1st, they probably already paid off their Social Security payroll taxes for the year because they make so much money. But everybody else, and probably most people listening to me right now, are paying 62% on all their income, and they're paying it not just until the first of the year, but they're paying it in every single paycheck. And so we think it's just a matter of equity that the wealthy pay their fair share of Social Security payroll taxes. So that's why we support legislation introduced by both Senator Bernie Sanders and Congressman John Larson and Congresswoman Jan Schakowsky and also Richard Blumenthal, Senator from Connecticut, that would increase that rate of payroll taxes, so finally the wealthy pay their fair share. And we, as I said previously, there's a reason for that because of the fact we used to capture 90% of income to pay for Social Security and payroll taxes. Now we're only capturing 81% of that money. So because of income inequality, it's time that the wealthy pay their fair share towards income taxes.
How much of an increase would you call for?
Well, again, it would be for on income above $400,000. So you could continue to tax people up to the limit that increases every year by the amount the wages increase. Right now, again, it's $168,600. And so from income from $168,600 to $400,000, you wouldn't pay any payroll taxes. But any income above $400,000, you would pay payroll taxes on.
Let's hear from Mary. Mary joins us from Ohio. Hello.
Oh, hello. Over 40 years ago, our graduate school class looked at Social Security and said we should have an actual actuarial review. And at that time, we said you should be age 70 to receive Social Security. And I know now that they're doing a step process, but why didn't Congress implement something for a review to determine, because when it was instituted, being age 65 was sort of a landmark that you couldn't usually make, and now you can live to 100. So maybe they could set up something for that review. Thank you. Take it offline.
Sure, and Mary, thanks for your question. There's been a lot of work on that, and there's actually been a lot of action on that. Again, the last time that there was major changes to Social Security was in 1983, and one of the things that was done in 1983 was to raise the Social Security full normal retirement age from 65 to 67. So that was great. It raised in over a number of years. Today, that's what it is for people who are born in the 1960s is age 67. Here's the problem, though, with doing that. Even if you live to 100, if you raise the retirement age, it's a benefit cut. And you don't have to do that. As I mentioned previously, you can raise the cap on Social Security payroll taxes to do that. But the other important thing to consider is it also depends on the blessing of longevity. Some people are lucky enough to live to 100, some people aren't, especially if they worked in jobs where they were manual laborers and that kind of thing. And so it's these proposals to raise the retirement age are especially harmful for individuals that don't have long longevity, that only live to age 70 or 80. And so that's why another reason. But even if you're lucky enough to live to 100, is a benefit cut if you were to raise the retirement age.
Republican line from Robert. Robert in Florida. You're next up. Hi.
Hi, how you doing? I got a couple questions. Would you please explain to me that 75% of my tax, I pay Social Security. I'm retired. I get a pretty good income, but I still have to pay 75% of my Social Security. I don't know what that is and how it works. Please explain it to me. I'll get off the line. Thank you.
Sure, and that's a very good question, Robert. Yes, and again, the last time major changes were made to Social Security was in 1983. That's when, for the first time, Social Security, that some of your Social Security benefits were taxable. And fortunately, the amount of money, the income levels in which you were taxed were not indexed, and so over time, a growing share of Americans had their Social Security benefits indexed. We think that's wrong. The Social Security 2100 Act, introduced by Congressman John Larson from Connecticut and Senator Richard Blumenthal, also from Connecticut, would change that. So finally, those thresholds would be indexed, and that would mean callers like Robert, that their Social Security payroll taxes would go down. We think that would be the right move, because we think it's especially hard for those individuals when they don't have any other sources of income to be taxed at that point in their life.
Aside from the legislators who are advocating the legislation that you talked about, what do you think is the general interest of making changes to preserve the future of either of these programs? And what do you think the delay is?
I think, well, the delay is a big, because there's not agreement on the right way to do that. So for instance, in this Congress, I think it's doubtful, and that's unfortunate. I think you need to have majorities at least in terms of the way we want to see the program extended, that would support revenue increases. So that's part of the reason. I'm sorry, what was the second question?
I was just saying, generally, if Congress knows these deadlines are coming, why aren't they doing something about it?
For the same reason. I think if they all agreed, we could do it tomorrow. We could raise the Social Security payroll taxes, but we don't have that agreement, especially with a divided Congress. And so until we have majorities in both houses that agree on what a solution is, it may unfortunately go down to the 11th hour in 2034 of making that solution. We hope we don't get to that place. It would be better to fix this problem now rather than later, because of these proposals that are available to us to extend solvency. They're more effective if we do them now versus later.
From Cincinnati, Ohio, John is on our independent line. Good morning.
Very good morning, and thanks for taking my call. And I'm 81 years old, and I think I started paying into Social Security when I was 16 years old. But anyway, they call this, like it's a benefit, and we paid into it. But the government workers, like Social Security Department, IRS, all the government workers, you never hear of their pension systems or anything running out of money. And like in Congressional District 1 in Ohio, we have they're paying for 6 different congressmen, 5 of which are no longer in Congress, but they get lifetime benefits and everything else, and you never hear about those people running out their funds, never running out. Explain that to me.
Well, I think that's a very good point to raise with your members of Congress. They do have a fairly solid system that's been in place for a long time, and for government employees, it's something that's again part of their compensation package that they get, and so I think it's an important point to raise. If you're going to have this system for yourselves, you need to make sure that the system that's available to the general public through Social Security is there for them. They earn these benefits, and because of the fact that they're so extremely popular, regardless of party affiliation or age, that they need to step up to the plate and do it in a way that extends the program without cutting benefits.
Susan in Fort Wayne, Indiana, Republican line. Hello.
Hello. You mentioned that Trump wanted to cut $65 million, but I'm wondering how much theft and fraud is there every year, and maybe you're misunderstanding what he means by cut, because anytime anybody tries to talk about privatization of Social Security or some other ways to be able to save save it for later years, they are totally demonized. And you see the Democrat pictures of rolling the wheelchair of the grandma off a cliff and how they're going to cut Social Security and take it away from you. And and so actually you talk about fixing it, people coming together and fixing it. But anytime anybody tries to fix it, you demonize them, I'm talking about the Democrats. They demonize them, and my other question is, how much money has Congress stolen from Social Security? So, when you talk about Trump wanting to cut it, maybe he didn't mean cut and cut by removing it all. Maybe he means cut by trying to fix it, and the Democrats are just twisting that to make it sound again like he's anti-Social Security, which I really don't think he is.
Okay. Susan there in Indiana, like we said, the president responded to this afterward on Breitbart and other forums, but
right,
go ahead.
Sure. Well, Susan, there's a lot to unpack there, because I think you asked, I think I'm counting 4 questions at least, or at least 4 points. In terms of fraud, it's one of the most efficient programs that the government runs. It's remarkable that in terms of just Social Security and Medicare, just in terms of Social Security, the overhead is that the administrative costs is about 5% of the cost of the benefits that are paid. So it's pretty low. Again, because of the fact that no program is perfect, whether it's private or public, and in both private and public programs, there's fraud, waste, and abuse. We think that's an issue that should be addressed. And we know that the new commissioner at Social Security, the former governor of Maryland, Martin O'Malley, that's like at the top of his agenda, and that we know that in conversations we had with him, he's working very hard to do that. So I would disagree with the characterization that there's not a tremendous amount of fraud in the program, but I think more should be done and is being done to take care of the program. In terms of money being stolen from the program, that hasn't happened. There hasn't been a dime stolen from the program. Every beneficiary since 1935 has got every penny of benefits that was promised to them that they earned. And in terms of cutting the program, look, if you're somebody, the president himself, if you go to look at the president's budgets, when he submitted that are public information, he suggested cutting Social Security by $64 billion. If you receive less money in your Social Security check because of something the government did, I think you're pretty clear to you that's a cut. I know that just one small point is that some tried to sell a cut in cost of living adjustments. This is not a cut, because with a cost of living adjustment, what happens is your check goes up this year by 3.2% from your December check, your January check. And so they argue because your check hasn't, the amount of your check hasn't gone down. Well, that's not a cut. Well, it certainly is a cut to you, because next time you go to the grocery store or to a restaurant, you're going to find that prices have increased. But if you don't have enough money, if you have the same amount of money in your pocket, how are you going to pay for those things? And so for those people, it's very clear to them in that situation that it's a cut.
Shelley in Michigan, independent line. Hi.
Hello. I have a question regarding the survivor benefit for widows. The minimum age to start drawing on that is 60 years old. Is that going to be discontinued? And then my second question is, how do they determine the amount that is received
thanks, Shelley.
by the survivor?
Right. Thanks, Shelley. Those are good questions. I haven't really seen that in terms of cut proposals. That's one I haven't seen in terms of cutting survivor benefits. In fact, I think it's going the opposite direction. Again, this legislation that we've been talking about that's been introduced by Congressman John Larson and Richard Blumenthal does have improvements to survivor benefits, so that it's high. That usually it's limited by household amount of both spouses. When one passes away, that amount would be increased. So that's a great thing. But survivor benefits is really important because of the fact that if you do have one breadwinner pass away and the other one's still there, it'll mean a significant drop in the income of your household, and you're going to need that income. So that's why we support these provisions that would make survivor benefits enough so that people could live a good quality life. So, Shelley, that's a great question.
Our guest organization's website is ncpssm.org. Dan Adcock with the National Committee to Preserve Social Security and Medicare. He serves as the Government Relations and Policy Director. Thanks for your time.
Thanks, Pedro.
Coming up in about a half hour from now, we'll discuss the legal issues